In this episode of Carpe Diem.
There are over 100 different types of arthritis. In Canada, it affects more than 4 million adults, mostly women. Can we avoid it? What can we do to ease the pain?
Carpe Diem. Seizing the day for Canadians as we age.
Welcome. In this show, we're talking arthritis and how it affects our quality of life as we age. But first, this week's Zippy Zoomer, Frida, the super sewing grandma.
With our Zippy Zoomer segment. We're here in Cloverdale with 75-year-old Frida. She has been sewing since the age of 17.
Okay, Leah, let's go ahead to the sewing machine. My daughter took figure skating and I started making her costumes, and then everybody wanted costumes.
Everybody, yeah. So that was just the thing. Everyone starts asking and you're turning them over.
Yeah, well, when she started figure skating, the costumes that were out there, well, they weren't very nice. This one ready.
For Cinderella.
That you can take with you.
Beautiful.
So I went home and grabbed some material and made her a dress, and she went to the rink and everybody wanted a dress like she had.
She's just a go-getter with the community. She's just kind of helps everybody that's in Cloverdale here. Everybody knows her. Some of the costumes. This is Cinderella.
She made them?
She made them. Mm-hmm.
No way.
Yeah. And she's just so active, and I don't think the people actually in Cloverdale want to see her ever retire.
Here comes Patrick and Annie.
Hey,
Annie is with the Legion. Now Annie and Patrick are also founding members of the BIA.
So you're running around with the BIA, you're doing all that volunteering stuff, and then you're running back here and you're making more costumes. How do you keep the energy up?
Keep your imagination going. The imagination is a wonderful thing.
Yeah.
Okay.
I'm looking good. We're going to head back to the studio with Carmen. In the meantime, if you have a Zoomer to nominate, don't forget to contact zippyzoomer@carpe.ca. Don't I look good?
That was fun. And I love that Cinderella dress. She's quite a go-getter, that Frida, isn't she, Wanda?
You know, she really is. And I think she illustrates what we see more and more Canadians are not retiring. They're saying, you know, I might be 65 or 70 or even 75, but why should I give up something that I love? And it's really interesting because when people stay engaged in the community, they tend to stay younger and healthier and often happier.
Isolation is definitely something that we see a lot for people with chronic disease. So being able to see her like that, be able to engage the community is definitely something that we would like to see a lot more often.
Yes, and with isolation, it means you're usually sitting on the couch, spending more time sitting. The more you sit, the more you have back pain, the more you're at risk for arthritis. So
the
you
smaller
want to
your
get off
world
the couch.
gets.
Exactly.
Yeah.
Great advice. We're going to take a break. When we come back, we're going to discuss the types and causes of arthritis. But before that, how does it impact you? Watch this.
Oh, it's very, very painful, severely painful, because what happens is the material between the bones, it sort of disintegrates, and then your bones grate together.
I couldn't even button up my blouse. I couldn't dress myself. I was still working, and it would take me 20 minutes to get out of my car to go into the office.
Carpe Diem. Seizing the day for Canadians as we age.
In Canada, arthritis affects approximately 50% of women and 39% of men at age 65. Although there are over 100 different types, osteoarthritis is the most common. Alan, what is arthritis?
So as you mentioned, there are more than 100 different types of arthritis, and there are two main categories of arthritis. And one is the degenerative arthritis, which is due to tear and wear of our joints, and is specifically the cartilage. And the most common type is the osteoarthritis. 1 in every 6-7 people have osteoarthritis. The other type of category of arthritis is the inflammatory type of arthritis, where your immune system attacks your joints, causing inflammation, swelling, pain, stiffness, and fatigue. And the most common type is the rheumatoid arthritis.
So is the arthritis really just like the cartilage missing, or what's the deal with it?
Right. So with arthritis, it's due to a breakdown or damage to the cartilage. Cartilage, like a sponge, basically absorbs a lot of the shock that we do on a daily basis. So when it's if it's due to tear and wear, or whether it's due to your immune system attacking the joints, it's causing damage in that area, causing swelling and the stiffness.
And Dr. Liza, in your practice, what have you found?
I would say majority of people suffer from some degree of arthritis, especially everyone over the age of 50, because if we're talking about wear and tear causing arthritis, obviously the older you are, the more wear and tear you have. For athletes, that is accelerated because of more impact on the joints. So if you're a runner, you're going to see faster arthritis in your feet. If you play basketball or anything that involves jumping, you'll see more in your knee. And then the hips are also weight-bearing joints, so especially in people who are very overweight, you're going to see early arthritis in their hips as well.
And you have a personal story because you were an extreme athlete yourself.
Well, I wouldn't go that far, but certainly when I was doing triathlons, I was working with a physiotherapist, and she told me that I would need to stop running, that I had pre-arthritis, which has now blossomed into full arthritis, so that I have pain in my big toe.
As you mentioned, you have arthritis in the big toe. Very common with women, more so because of wearing high heels. So when you're wearing high heels, a lot of the pressure is put on the base of the first two toes, so therefore you have more wear and tear on those joints. Secondly, there's something called pronation. Pronation is when you're rolling in too much. When you roll in too much, that means you have added wear and tear on this first toe. So especially with the foot, you're going to see that more people have arthritis in the first toe, or the big toe, because of this overpronation. One of the reasons, though, that so many people are overpronators is actually from too much sitting. So when your hips are in a flex position, so in a seated position, they get tight. When they're tight, they actually pull your hips in and make you roll in on your big toe. So as we sit more, we roll in more. As we roll in more, there's more wear and tear on the big toe, and therefore more arthritis. So many people who have arthritis in the feet, definitely the big toe.
Speaking of feet, our colleague Darren Maharaj went to visit you, Dr. Liza, at your clinic in Toronto, and we have this clip for you. Watch this.
Well, for many Canadians suffering from severe arthritis, something as simple as walking can feel like torture. Luckily, we've stepped into the offices of the Fix Medical Clinic here in downtown Toronto for some expert advice from manual osteopath to the stars, Dr. Liza Egboga.
Okay, so do you feel those crunches that I feel in your feet?
Yes, a little bit more sore than the other parts.
As I'm doing it, do you feel that the pain is decreasing?
Yes.
Okay, perfect. Well, when it comes to arthritis in the feet, after the age of 65, over 50% of women will suffer from pain in their feet due to arthritis. With men, it's actually 33%. And it's not just people who are over the age of 65. Between the ages of 45 and 65, over 25% of women will actually suffer from arthritis in their feet.
Because we used to wear high heels, it used to be sore, especially at near the toes, that part, and the heel. So with the treatments, the pain disappears, and then you feel a lot better.
Going through treatment, doing osteopathic treatment, massage therapy, reflexology are great for maintaining mobility, and wearing custom orthotics as well. They add some of that shock absorption and that padding that you lose with age. So when you wear those on a daily basis, you can prevent the progression of arthritis and prevent the inflammation that causes pain. One of the exercises that you can do that's great for helping with arthritis in the feet is to strengthen the intrinsic muscles in your feet, and that's with towel pickups. So to do that, you're using your toes to pick up the cloth, you're going to move it to the side, and then you're going to take the other foot, and then you're going to pass it back. And then you're just passing the towel back from foot to foot.
For more tips on how to overcome arthritis pain, visit carpe.ca.
Dr. Liza, tell us about that patient.
So she's obviously someone who's kept very, very active and has done maintenance treatment. So although she suffers from arthritis, she doesn't actually have any pain because she exercises, she keeps her weight down, and she comes in for regular treatments once a month to maintain the mobility in her joints. So even though she has those degenerative changes in her joints, because she is over 65, she doesn't actually have the pain or inflammation associated with it.
And do you have pain in your feet?
I do. When I walk a distance, more than say half a kilometer, my toe starts to get very sore. And I'm also worried because I look at my mom and her hands are, and my mom is a tough woman, she's amazing, but her hands are almost claws and she's got such swollen fingers, and I wonder, is it genetic? Is that my future?
Well, there definitely is some genetic tendency, and that's why medications are very important, especially if you have inflammatory type of arthritis. Finding out what type of arthritis that you have can correctly get you treated. For example, if you need medication or not, or over the counter, or physiotherapy, or chiropractor, or any other allied healthcare provider services to be able to manage the arthritis properly.
Yes, and the key is early detection, because if you can detect arthritis early on, you can prevent some of the future damage, and that's what you want to do. You want to stop the damage before it happens, or at least delay the progression of damage. So getting a diagnosis is first. The sooner you get a diagnosis, the sooner you can get appropriate treatment and delay any further progression of the arthritis.
And we like solutions, and what can you do to manage your condition? When we come back, our colleague Darren Jones shares his experience living with arthritis.
Coming up on Carpe Diem.
I'm now taking something called methotrexate, which is an injectable medication. It suppresses the immune system and it decreases the inflammation of the joints.
Carpe Diem. Seizing the day for Canadians as we age.
Welcome back. We're talking arthritis. How do you live with it? Our colleague Darren Jones filmed a video diary for us.
Hi, my name's Darren and I have psoriatic arthritis. Before I was diagnosed, I was getting pain in my jaw and my lower back, and thinking it may have been my wisdom teeth, I had them removed. But shortly after, the pain was still there and my back was getting worse. There was pain in my knees and I was getting pain and stiffness in my hands, and it was making it very difficult to do mundane things like use a can opener. I like to play music, but the pain in my hands and the stiffness was making it very difficult to play the guitar. I'm not like a retired rock and roller or anything. I'm in my 40s, but the pain was just too intense to play. Given that I had a history of psoriasis, it was determined that I had psoriatic arthritis. So we tried a number of different medications that worked for a while, but the stiffness and the pain was continuing to get worse. And even picking up my young sons was very painful and difficult, and it felt really debilitating. I'm now taking something called methotrexate, which is an injectable medication. It suppresses the immune system and it decreases the inflammation of the joints, but it has its side effects like anything else. Firstly is the anxiety of having to inject it myself. But secondly, the next day I feel nauseous, I have haziness and fog, I'm tired and lethargic. But to have the pain and stiffness of the arthritis lessened makes it all worth it. Arthritis is very debilitating and painful. I remember my grandmother suffering from it for years, and now that I have it myself, I honestly wouldn't wish anybody to have it.
Darren seems to be managing his condition, but he has to inject himself every week.
Right, so psoriatic arthritis is one type of inflammatory arthritis where your immune system is attacking the joints. And that's why the medication, for example, the one that he's using, methotrexate, can control the immune system properly to stop that attack. There are other type of medication that works at the level of your immune system, for example, biologic or biosimilar, and that is why it's very important to get the correct diagnosis of your arthritis so that you can be treated as soon as possible and properly.
I've heard that one of the ways to control my arthritis is by giving up sugar.
Unfortunately, your diet does play a large role in inflammation, and there have been quite a few studies associating sugar consumption with the progression of inflammation. Also, some of the other things that you eat in certain people can affect the level of inflammation. So I myself had a patient who has rheumatoid arthritis, so she was taking methotrexate, and she's decided she wanted to try modifying her diet. So she went on the anti-inflammatory diet where she cut out nightshade vegetables. So those are the ones that come from dirt, like eggplant, potatoes, and tomatoes, and also started incorporating some natural things in her diet like ginger, which has been proven to be anti-inflammatory. And she actually stopped the methotrexate and was just able to manage her arthritis with her diet. But in other patients, they've tried the anti-inflammatory diet and it hasn't made much of a difference, so they've had to continue with the medication. So it depends on the person.
You know, and I've heard antioxidants are a good thing to eat.
Yes.
What are those?
The thing is with antioxidants, it's when you think about, as Ellen mentioned, destruction of the cells or an autoimmune response to the cells, antioxidants are protective against that. So things like blueberries, there's a lot of berries, there's a lot of fruits, vegetables, teas, like green tea is very high in antioxidants. Acai berries are very high in antioxidants. That can help with your body's immune response and destruction of the joint. So it's definitely helpful and it's good for you.
And that's something that we can do at home by ourselves.
And it's delicious. So.
And it's good for you. And here's something else that's good for you, some tips on exercises.
Self-massage provides quick relief to painful knees. Leg extensions improve mobility in your knees. Contracting your muscles with a towel squeeze exercise builds strength. Marching in place improves range of motion in your hips and knees.
Alan, it seems that exercise and diet do help.
Right, so in addition to proper exercise and proper diet, there are some alternative therapy and supplements such as glucosamine. Some people do experience reduced symptoms as a result of these supplements or alternative therapies.
And might I add that there have been several studies showing that ginger and turmeric are as effective as some anti-inflammatory medications when it comes to arthritis.
You know, I worry about our members because as seniors, they're vulnerable to frauds and scams, and especially if they're in pain, they're looking for relief. I mean, Ellen, have you had experience of products that are sold that really don't deliver?
There are definitely a lot of products out there that claim to cure arthritis, and it's very important to understand that there is no cure for arthritis. All the things that we do, including supplements and alternative therapy, they can reduce some of these symptoms. And some of these products, if it's not sold properly or if it's not being controlled properly, they can actually cause more damage to your joints.
And Alan, here's a question. If you're already on prescription medication, you have to be careful about other supplements because everything has a cause and effect, right?
Right. Some of these supplements does interact with your medication, and that's why it's very important to actually talk to a pharmacist. A pharmacist has database on the interaction of these medications. So when you talk to a pharmacist can say, okay, this medication might interact with this one, or even might interact with some of the supplements.
What about surgical interventions? Are those sometimes called for?
Right. So when your arthritis pain or stiffness gets too much, that you're not able to move, that you're or do any daily activities, doctor might refer you to a surgery.
And most often they recommend that you do 6 months of conservative care, so that can be physiotherapy, osteopathy, chiropractic massage. There are 6 months of conservative therapy before undergoing surgery, because if you're going to achieve results without surgery, you want to give it at least 6 months before doing so.
We need to take a short break, but before that, we asked these Zoomers how they deal with arthritis.
Last March, I could hardly walk because my knee was so bad, and the doctor advised that I have surgery. And I said, I don't want surgery. What you suggest that I do instead? And she said, you do your underwater exercises.
Sometimes it hurts, but if you keep doing it and keep doing it, it does help.
Carpe Diem. Seizing the day for Canadians as we age.
Welcome back. Before the break, we heard from people managing arthritis. Exercise was a common tip. Alan, what else?
We talk about proper exercises and proper diet and use of tools to prevent stress on the joints. We also talk about supplements and alternate therapies. We definitely do encourage people talking to their doctors on an ongoing basis. Rheumatologists and your GP are not the only person dealing with your arthritis. Physiotherapists, occupational therapists, allied healthcare providers, they can all provide care to your arthritis as well.
He is early detection, so no one should assume that any amount of pain is normal pain. There's no such thing as pain that is normal. So if you are feeling pain in your joints, you should see your doctor, you should see your therapist or healthcare provider to determine what is causing that pain. Because as we said earlier, if you catch arthritis earlier and you can stop the progression and you know what to do going forward, you're going to have less pain and less damage to the joint.
Wanda, final words?
You know, at Carpe, we don't focus on a particular disease, but there's something that arthritis sufferers have in common with so many of our members as they get older, and that's the fact that they are facing long wait times for necessary surgeries. And for individuals with arthritis that are looking for a knee replacement or a hip replacement, those surgeries can be 6 months, a year, or even more. It's one of the reasons why Carpe fights for its members, for all older Canadians, because I think if youngsters, if teenagers were waiting, had to drop out of school for 6 months or a year because of pain, that would be fixed. And we need to fix this for others, which is why it's so critical that people who support our cause join Carpe. So if you are a senior, you love someone who's older, or you aspire to be older yourself one day, please go to carpe.ca/join, join Carpe, add your voice to ours. Together, we can make sure that every Canadian lives with dignity and respect, no matter their age, their pocketbook, or their postal code.
Thank you, Wanda. Dr. Liza, what a pleasure to have you on this panel.
What a pleasure to be here with you all.
And Alan, lots of
you.
information to be shared. Thank you so much for
Thank
that.
you.
And that's the show. Remember, as our CARP president Moses Neimer always says, the best way to keep going is to keep going. So stay zippy and seize your day.